Hello friends, myself Dr. Navnitasi. Today we are here to discuss regarding doping in sports. What is doping? The use of any substance foreign to the body and taken with the sole intention of increasing in unfair manner his or her performance in competition. The substance may be in the form of medications like injections and tablets and the methods of blood transfusion, etc. Why athletes take drugs? Stimulate the body, build mass and strength of muscles or bones, reduce weight, to relax, used as a masking pain, hide the use of other drugs, increase in delivery of oxygen to exercising tissues. Types of doping. The types are stimulants, narcotics, beta blockers, diuretics, anabolic steroids. Stimulants are psychoactive drugs which induce temporary improvement in either mental or physical function or both. Sportsmen uses it for to enhance alertness, wakefulness and feeling of reduced fatigue. Effects of athletes: increase in aggressiveness, possibility of getting injuries, effect on decision making capacity, increase heartbeat and blood pressure up to a certain level, bleeding in brain. The narcotic doping painkiller effects on athlete: relief from pain, increase in strength. The side effects are athlete is habitual, induce is to possible to injured part or damage. Use in game long distance running cross countries. The drugs are mentioned over this slide. Beta blockers. The drugs are used to help in reduce frequent migraines, to treat hypertension, to help in controlling anxiety. This is used to increase a concentration and accuracy. Side effects are hypertension, nausea, sexual dysfunction, heart failure, fatigue, hair loss. Used in games like archery, rifle shooting, pistol shooting. The drugs are ethanol, nadolol, propanol, etc. Diuretics. Use the drugs to lose weight and enter a lesser weight category. Effect on athletes: lose his weight, wash out other doping substance through urine. Side effects are body can come in the state of consciousness after dehydration, decrease maximum oxygen uptake capacity and physical workload. Diuretics are used in games like wrestling, judo, weightlifting, athletic and boxing. Drugs used are mentioned on the slide. Please refer these. Anabolic steroids. Effect on athletes: to develop new cells up to 20% increase in strength. Side effects are unnatural hair fall, unnatural changes in women athletes, imbalance of the hormones in human body. Anabolic steroids are used in the games like football, weightlifting, throwing events. The drugs are stanozol, exerdenol, clostrobol, etc. Blood doping. Very rarely method of doping. Blood transfusion is the intravenous administration of blood, red blood cells or related blood products that contain red blood cells. In this, blood is removed from an athlete and stored in a frozen state and re-injected before competition. Positive doping cases in India are Monica Devi, Ashwini Akunji, Mandeep Kaur, and the international athletes which are charged with the doping: Tiger Woods, Maradona, Ben Johnson, and 23 cyclists in summer 2006. Conclusion: a number of diet and food supplements as well as various drugs and hormone stimulants are used quite frequently in athletics as ergogenic aids to enhance performance without knowledge of the long-term side effects. The World Anti-Doping Agency, which is also known as WADA, is an independent foundation created through a collective initiative led by the International Olympic Committee. It was set up on November 10, 1999 in Lausanne, Switzerland. The International Olympic Committee, as well as most other medical and sporting control bodies, have established strict regulations outlawing the use of drugs in sport. I hope that you enjoyed the presentation. Thank you. Thanks a lot.